Today's lecture is on safety and patient reception. The Medical Office Safety Plan. Suggested components of this plan would include a OSHA hazard communication binder, electrical safety binder, fire safety binder, including the PASS and RACE acronyms and plans, emergency action plan, including a set of a map on the wall in the hallways of emergency exits, chemical safety, including safety data sheets, bloodborne pathogen exposure information, personal protective equipment information, and needle stick prevention and reporting information. The OSHA hazard communication standards include requirements for workers to have the right to know about chemicals in the workplace, and updated to align with United Nations globally harmonized system of classification and labeling of chemicals. Safety data sheets contain the information and are kept in a binder in an open space near laboratory workspaces. There should be one in your classroom on the counter in the laboratory area for you to look at. Each chemical container must have a hazard label on it. Safety data sheets require the first 8 sections as mandatory. Section 1 is identification, the names of the element. Section 2 are the hazards identification. Section 3 is the composition of ingredients. What is the chemical makeup of this ingredient? Section 4 is first aid measures if exposed. Section 5 is firefighting measures. Some chemicals cannot be treated with water. Section 6, accidental release measures. Section 7, handling and storage. And Section 8, exposure controls and personal protection. Do you need to wear gloves, a mask, a hat, a gown? Do you need a face shield? What do you need to have on your body to protect you when you're using a specific chemical? Now, the second 8 sections are physical and chemical properties of the chemical, the stability and reactivity of the chemical, the toxicological information, the ecological information, what kind of damage can it do out in the environment, disposal considerations, can you pour this down the drain or does it have to be disposed of in a specific manner? Transport information, can it be transported without any probable problems or does it have to be transported in a cooler or in a chemical transport container? Regulatory information and other information that may be needed. One such chemical that is in your classroom and in the medical practice offices is water. There is a safety data sheet on water. Alcohol, rubbing alcohol. There's a safety data sheet on rubbing alcohol. There is a safety data sheet on the alcohol-based hand sanitizers that are used. So it's not just chemical laboratory chemicals such as hydrogen peroxide or hydrochloric acid. It's everyday chemicals we use. The labels must be quick and have simple graphics so you can see what's there. The manufacturer's name and address must be easily identified. It must have a product identifier. Single words such as danger or warning must be on the label if needed. Hazard and precautionary statements and pictograms as mandatory biohazard labels. Electrical safety. Safeguards to reduce electrical hazards. Avoid using extension cords. Why would we avoid using extension cords? They could overheat and cause a meltdown. Somebody could trip over them, or someone could get caught by them when walking by. Repair or replace equipment if there is a damaged cord. Don't wrap it up in duct tape. Avoid wet or damp hands while using electrical devices, or if danger of being in contact with water. Fire safety. Many potential hazards with high voltage medical equipment are possible. Fire prevention. Be watchful for extremely flammable materials. Smoking. Inoperative smoke detectors. Although there is no smoking allowed in most offices, there are smoke detectors because they're needed for other types of smoke, such as combustibles. In case of fire, use fire safety equipment and use the PASS acronym for extinguisher. Pull the pin, aim the nozzle of the fire extinguisher, squeeze the handle and sweep from side to side at the base of the fire. Use a fire blanket. Know where they are. Know where all the fire extinguishers, the fire blankets, and the fire emergency exit routes are in your classroom, in the school, and where you are working. Evacuate the building. Have an evacuation plan. Look at those maps on the walls to find out where you can go. Practice fire drills. Know evacuation routes and procedures. And know local emergency contact numbers. That would be 911. Chemical safety. Proper labeling and storage is needed. Store hazardous substances below eye level and wear protective gear such as goggles or face shields. Use gloves if needed. Carry chemicals with both hands and work in a ventilated area if needed. Do not inhale chemicals directly and use a fume hood for chemical vapor. The vapors are pulled up into the hood and filtered before they are sent out into the air. Use ventilation device if indicated. No random mixing of chemicals and no mouth contact with pipettes. Always add acid to a substance instead of adding a substance to acid. Clean chemical spills according to waste control procedures, not with bare hands. Know where your chemical spill kits are. And locate and use the eye wash station when needed. Where is your eye wash station in this classroom? Do you know? Ergonomic and physical safety. Ergonomics is the study of the way people work. We call it body mechanics, how we move. Workplace injuries are secondary to poor posture. Body mechanics can reduce the likelihood of injury. Do not overextend your reach. Do not climb on chairs and desks. Use proper technique to lift with your legs. Ask for assistance with lifting when needed, and adjust your seating to the correct position. Take breaks from your computer work. Physical safety. Walk, do not run. You've probably heard that since you were a kid. Wipe or mop up spills immediately and then place one of those wet floor signs by the spill. Clear floor of dropped objects. Trim any snags in the carpet. Dispose of medication dropped on the floor. Close all doors and drawers. Watch for rough edges on furniture and counters. Keep electrical cords from being tripping hazards. And don't use broken equipment or supplies. Laboratory safety includes no eating or drinking in the laboratory, no application of makeup or lip balm in a laboratory, and first aid kit needs to be ready and available. Know the location of eye wash and shower stations and wear protective gear as needed. Preventing injury in the front office. Pay special attention to ergonomics. Prevent repetitive motion injury to forearm, wrist, hand, or back from typing, lifting, bending, stooping, and sitting. Take a break every 20 minutes from what you're doing, even if you just turn your chair around, shake your hands out, and stay off the computer. Special safety precautions should be in place for children and patients with physical disabilities. Design of the reception area. The reception is a place to be greeted. Avoid using the term waiting room. Furnishing, colors, and patient flow depend on type of practice. For a pediatrician's office, pediatric office with children, you may want to have more solid colors, like the normal colors of the color wheel, and maybe brighter colors. For an office for adults, you may want quieter colors. Medical assistants can make area welcoming, safe, and efficient. Size and schedule. Anticipate the daily patients by hour and day, and look out and watch out for overlapping schedules which may need management. So you have enough space in your reception area for your patients. The utilization of space differs by type of practice. Orthopedic geriatric office may need space for wheelchairs and walkers. A pediatric office may need space to separate sick children from well children. Overcrowding could cause germ transmission or HIPAA violations. The decor. Colors and fabrics in a color family work well together and create a certain feel. Red increases the heart rate and blood pressure. Blue causes a calming effect. Green is relaxing and easing on the eyes. Light brown is warm and inviting. Black or dark brown tends to be powerful and depressive, and white is cleanliness and purity. Furnishings. Comfortable, stain resistant. No sharp edges. Arranged with good spacing. Specialty items such as plants, aquariums, or toys enhance decor, but could also be overwhelming. For pulmonary specialty offices, no plants are allowed because they carry Pseudomonas aeruginosa microorganism, which can cause severe and death-causing infections in lungs. Other considerations: lighting, right in the middle there, not too bright, not too dark. Room temperature should be warm, and there may be soothing music on or no music at all. And what do we have now in most waiting areas? We have flat screens. And sometimes the Weather Channel's on, or HGTV, and sometimes there are educational materials on those flat screens. Speaking of educational and entertainment materials, you can have magazines and books, patient information packets, medical information, bulletin boards, or flat screens. Television and videos are an alternative to reading material, and they have captions in various languages if possible. Accommodating children. Furniture in a smaller size. Separate area for sick children who are potentially contagious. Most offices, if they have a child coming in who may have a contagious disease, will tell the parents, wave from the door or tell me right when you're getting here, and the office staff will relocate them to a room that's set aside, a practice room or an examination room for sick or potentially contagious children. Games and activities tailored to children. Toys should be easy to disinfect and without small pieces which could be swallowed. The importance of cleanliness. Housekeeping. And we don't mean deep housekeeping that a housekeeping service would do. We mean just maintain a normal type of housekeeping. It's a usual part of a medical assistant's duties. Wipe down the counters, throw away damaged magazines. Usually now you'll see masks and hand sanitizer at the reception desk. Make sure that those are replaced and tidied up as well. And this is daily cleaning. There may be a need for emergency cleaning. All right, and it may be done by a professional service. So housekeeping for MAs is usually just tidy up your area. Professionals usually clean the practice after hours. How about removing odors? Reaction to odors can be increased when patients are not feeling well. Body fluids and other chemicals can contribute, especially in combination. Non-smoking zones should be especially respected. And to be honest with you, I don't think there's any healthcare waiting area or reception area that allows smoking anymore. Infectious waste. Biohazardous waste or infectious waste can be dangerous to people in the environment. It's not common in the reception area, but can happen if a patient vomits or is bleeding. Then we have to follow the OSHA guidelines for cleanup and disposal of the waste products. Office access for all. Parking arrangements. Is there parking on the street? Is there a parking lot with space for handicapped? And does it allow space for patients and staff? Is a parking garage used? If so, is it well lit, and is there enough space included for handicapped? All these things are part of taking care of a practice. Entrances clearly marked. Dr. Jones' office here. Name of practice and physician on door. Doormat to control debris being tracked in. Some places do not have doormats because they don't want people tripping over them. A foyer or place to adjust the temperature. Wide enough to accommodate wheelchairs and other assistive equipment. Most practices now have automatic door openers, so you can get through the door if you're on crutches or in a wheelchair. Well lit and without obstruction. How about safety and security at the building exits? Security systems. Do you need a pass to get in? Are cameras in place? Can you push a button and say, "Hi, I'm here for Dr. Jones' office," and the door opens? And consideration for patients with special needs. Special needs of all should be accommodated. Are there ramps and the electric door openers? Is there additional space for patients with needs? The Americans with Disability Act requires that There is enough space for everyone with special care needs. And service animals. We need to have a place for our service animals as well. How about special needs for vision and hearing impairments? Or preparing the reception area for a child with autism? What about the Older Americans Act of 1965? How about special situations such as patients from diverse cultural backgrounds? Or again, patients who are highly contagious and need to be seen and taken to and seen in a examination room right away without sitting in the reception area. Now, function of the reception staff. Patient registration and HIPAA. Receptionist has the patient sign in electronically on a digital pad or a computer in the reception area, or on paper, copies or scans ID and insurance card and signature obtained. Most days they ask for 2 forms of identification, your license and your insurance, and they're both scanned through the system to make sure that they are active, and that scan of that insurance information goes right to the insurance company to validate your coverage. Payment. Co-payments are usually collected as you check in. The front office will take care of handling cash, checks, or debit or charge cards. Most practices no longer accept checks or cash. You will have a follow-up or referral appointment after you've seen your provider, and we will offer you a very pleasant farewell as you leave the practice. Observation and updates. Do not make patients wait if they are complaining of chest pain, shortness of breath, bleeding, feeling faint, vomiting, or undiagnosed or possibly contagious rash. Most offices, if you have chest pain or shortness of breath, you're told to call 911 and go to the emergency room. What about the Identity Theft Prevention Program, which works at prevention, detection, and mitigation in case someone's identity is stolen? Opening and closing the office. Beginning the day. As a medical assistant, if you are in charge of opening or closing the office, this pertains to you. Arrive 30 minutes before official opening. Safely open entrance and deactivate security. Check answering machine or service for any reported emergencies, and turn on electronics and make coffee if needed. I'm not sure if that's the front office's responsibility anymore. Ending the day. Set the stage for the next day. Cooperation and communication between staff. Do you have everything you need? Do you have your patient list for tomorrow? Is everything ready to go? Turn off equipment according to office policy. Make sure the screens on your computers are turned off. Check the exam rooms. Make sure confidential information is stored, and notify the answering service or turn on the answering machine. Be alert for security hazards when leaving the building. And that ends our lecture today on patient safety in the reception area. Talk to you next time.